What attracted me to working at Junction 17 was the variety of inpatient wards for CAMHS that the service has, the location in Manchester, being close to the city centre, and being part of Greater Manchester Mental Health Trust. When young people first arrive on the ward, it's generally the most acute part of their illness. So working with a young person, their family, their carers, and getting them to the point where they can go back into the community and start looking towards the future is definitely the most rewarding part of the job.
So initially I was unsure to come and work within CAMHS. I've never worked with children before, but I did decide to take that opportunity, and I've never looked back, and I would never work outside of children's services. The role is completely different than working with adults. It's a lot more playful, we have a lot more fun, and we're able to hopefully support young people and young adults into making positive moves in the future.
CAMHS as a division is split into inpatient and community services. We have 2 hospitals, which is Junction 17 and also the Gardner unit. We have a day service attached to Junction 17, which also hosts Cloughside College. The reason that I chose to work with children and young people and families is because of the next generation, and really wanting people to have the best experience within their lives, and to make such a sustained change, why not start in the early years? A large majority of the services that the Trust provide are adult focused. The nature itself of having the privilege to look after children and young people brings a completely different dynamic.
Some of the activities that we do on the Gardner unit include things such as painting, origami, sports. We have a sports hall where the boys can play badminton, basketball. We've also got an AstroTurf for when the weather's nice, they can go outside and play some football. So I accessed CAMHS services myself growing up, and that made me want to work within CAMHS due to wanting to kind of be there, obviously with my own personal experiences, wanting to put that into other young people going through similar situations.
I found the services really helpful. I definitely utilised them a lot. Everyone was really kind and caring, and it was a very supportive environment. They used to take me to the stables because I used to like seeing horses, and we'd go to Heaton Park and walk around and we see all the farm animals and stuff. I don't think I would be as well as I am today if it wasn't for the CAMHS services.
The inpatient support I got is quite intensive support, and I think at the time that I was in inpatient services I really needed that. There was a lot of playing games and things, occupying your time. We did a lot of arts and crafts, and I got a lot of support from people that was really helpful for me.
Recently we have been awarded the quality mark with the NHS England gold standard for our preceptorship work. We want to make our new nurses feel very supported and ready to be able to handle some of the key skills of nursing when they arrive, to get familiarised with their work environment, to have a one-to-one session with myself looking at what support they will need.
During the preceptorship we had preceptorship workshop which we attended for 5 days. We had developmental trainings or meetings with the PNE. We also had online trainings as well, which really helped us progress into my career as a preceptor nurse.
It comes with its own challenges, but I have been able to get the support of my team, and I've been able to develop resilience whilst on the job. For a young nurse like myself who is just starting off, to have her opinions and her skills being put to use, and members of the team feeling like I am a valued member of their team, it is such a rewarding process so far.
You know, I can really say that everyone here since I've started have been really, really helpful. There's been a real mix of people that are very experienced, that have been here for a long time. I always feel safe in forensic units. Even when I qualified, I've worked in forensics all my professional career, partly for the reason of forensic being so safe.
The benefits are definitely, obviously, working with young people, so there's so much hope, and you can inspire them from being a young age to kind of go on to the things that they want to achieve. And I think that's really important, that they have those role models at such young ages. At home I've actually got a memory box of things that young people have made for me over the years. So I have actually got cards and pictures that have been drawn for me, and it's really nice to kind of look over that on days where it might be quite challenging.
We've had multiple success stories, naming one. We had a service user that was with us for around 3 years, and he was quite a distressed patient. Initially we thought he'd be going into adult services, however with intervention and intense support we were able to see him going back into the community.
There are a lot of benefits for working for GMMH, so I first started here as a staff nurse and I've been able to progress through to Deputy Ward Manager, and I do believe that GMMH are able to offer those extended opportunities to help staff progress in their career.
So the care team within Junction 17 is made up of a variety of professions. So we have nurses from a mental health background and also general nursing for physical health. We have nursing associates and support workers. We also have within the team occupational therapists, dietitians, speech and language therapists, activity coordinators. We have advanced nurse practitioners, nurse consultants, psychiatrists and psychologists and lower grade medical personnel. To support the team we have a management and governance quality arm, and that would include professional nurse educators, safeguarding leads, our modern matron, operational and service management, myself as head of operations and a quality and nursing head too.
What I would say to someone for considering a role here is go for it. There's so many new things to try. We have so many different training opportunities. We have lots of fun, always new opportunities to try something new.